Hi, this is an assessment of the PRECEDE-PROCEED model. The strength of this model would be the focus on the community's needs. The community identifies their needs and wants, the community determines the desired outcomes, and the greater the community involvement, the more ownership, support, and commitment that will be given to the program's success. The weakness of the model is they could pay more attention to the predisposing factors. The assessment part of the model does focus on social, behavioral, environmental, educational, ecological, administrative, and policy aspects within the community, and all of these aspects are very important. The predisposing factors could influence all of those aspects, and these factors have just as much influence on the community. The assessments is what worked really well when applying the PRECEDE-PROCEED model to this diabetes case study. For example, the assessments determining that most of the residents in Wilcox County live in poverty with low education and limited access to phones, internet, or healthcare facilities led to an intervention that is most effective considering all these aspects. And the intervention is to have healthcare providers come into the community and provide services and education. The challenges with using this model was determining the best way to evaluate the program. At first I thought that the only way to evaluate the program was to get feedback from the residents through surveys or holding more community outreach events and speaking directly with the residents. However, after considering what I've learned as a public health student, I determined that hospital and doctor visits information can also be used to determine if the number of new cases of diabetes is down in Wilcox County and if complications related to diabetes are down too. Using this model again for a project like this, I would approach it differently by surveying the residents on how they would like to see the issue addressed. As I mentioned previously, the biggest strength of this model is the community involvement. I based my project and intervention on surveys just determining the health and health behaviors, and then decided to do a community outreach event. However, I should have had the residents more involved in how to approach this issue, or at least what they would like to see at the community outreach events, and what the outcome would be that they were looking for. So that's what I would do differently.